Now we'll see the thyrocervical trunk. The thyrocervical trunk arises from the first part of the subclavian artery at the middle margin of the scalenus anterior and lateral to the origin of vertebral artery. The branches are inferior thyroid artery, superficial cervical artery, suprascapular artery. Now inferior thyroid artery supplies to the thyroid gland, lateral muscles of neck, larynx, trachea and esophagus. Superficial cervical artery supplies superior muscles of posterior part of neck and dorsal scapular artery supplies superficial muscles of back. The suprascapular artery supplies supraspinatus and infraspinatus muscles of scapula. Internal thoracic artery, it is a branch of first part of subclavian artery. It is also called an internal mammary artery. Origin arises from the inferior of the first part of the subclavian artery opposite to the margin of the thyrocervical trunk. Course, it passes downward in front of cervical pleura, enters thorax behind the sternoclavicular joint and termination in the thorax passes vertically about 1.25 centimeters away from the lateral border of the sternum and at the level of 6 intercostal space. And here it divides into two branches, that is the musculophrenic and the superior epigastric arteries. Now the costocervical trunk. So the origin of the costocervical trunk, it arises from the posterior part of the first part of the subclavian artery on the left side. Course, the artery arches backward above the copula of the pleura and reaches the neck of the first rib. The termination of the costocervical trunk, it terminates by dividing into ascending deep cervical artery and superior intercostal artery. So in the diagram you can see the deep cervical artery and the superior intercostal artery. The deep cervical artery, it supplies to neck and upper back and cervical spinal cord, and the superior intercostal artery supplies upper two intercostal spaces. Veins of head and neck. Veins of head and neck are subclavian vein, internal jugular vein, external jugular vein and anterior jugular veins. The valve in the lumen are mostly absent in the veins draining head and neck area. This leads to two-way flow of blood dictated by local pressure changes. For this reason, infection in the head and neck area can lead to serious complications. Now the subclavian vein. Subclavian vein is the continuation of axillary vein. So in the diagram you can see the subclavian vein extends from the outer border of the first rib to the medial border of the scalenus anterior and joins the internal jugular vein to form brachiocephalic vein. Relations of subclavian vein: in front clavicle and subclavius muscle, behind subclavian artery with scalenus anterior muscle and phrenic nerve, below first rib and copula. Now we'll see the tributaries of subclavian vein. The tributaries of subclavian veins are external jugular vein, dorsal scapular vein, thoracic duct on the left side and right lymphatic duct on the right side. The important vein in the neck is internal jugular vein and it is clinically very important. So in the diagram you can see the internal jugular vein. Internal jugular vein is the largest vein in the neck. Origin begins as the direct continuation of the sigmoid sinus. Course at the base of the skull below the jugular foramen and descends vertically downwards to end behind the sternal end of the clavicle and joins the subclavian vein to form the brachiocephalic vein. Internal jugular vein drains blood and most of the tissue of the head and neck. Now we'll see the tributaries of internal jugular vein. In the diagram you can see the internal jugular vein. The tributaries are pharyngeal vein from pharyngeal plexus, common facial vein, lingual vein, superior thyroid vein and middle thyroid vein. We'll see the ansa subclavia. The ansa subclavia is a part of the sympathetic paravertebral trunk on each side of the spinal cord. It is the part that passes anterior to the subclavian artery. Now this ansa subclavia is a nerve cord that is a connection between the middle and the inferior cervical ganglion which is fused with the first thoracic ganglion. The subclavia ansa forms a loop around the subclavian artery. In the deep of the neck, the sympathetic chain gives rise to several structures, that is internal and external carotid plexus, cardiac nerves, ansa subclavia, vertebral ganglion. The brachial plexus, again it is a content of a root of the neck. So in the root of the neck you can see the root of the brachial plexus, and in this diagram you can see the subclavian artery continues as an axillary artery. The thoracic duct which lies in the neck. The thoracic duct is the largest lymphatic vessel that drains up to 75% of the body lymph. Origin of the thoracic duct, it arises from the cisterna child, termination at the junction of the left subclavian and the left internal jugular vein. Extents of the thoracic duct, it extends from 12 thoracic vertebra to the root of the neck. Formation of the thoracic duct formed by right and left lumbar limb trunk as well as the right and left intestinal lump trunk between T12 and L2 vertebra. The thoracic duct drains the lower extremities, pelvis, abdomen, left side of the thorax and left upper extremity and left side of the head and neck. Now the most important structure in the neck, that is the carotid sheath, which I have forgotten. So I'll be telling you about the carotid sheath. In the last lecture, the deep cervical fascia, we have studied the formation of carotid sheath, as you know how it is formed. So I'll not go much in detail. Then you know what are the contents of carotid sheath: the common carotid artery, the internal carotid artery, and the internal jugular vein and the vagus nerve. These are the content of the carotid sheath. Now the most important structure in the neck is the common carotid artery. There are two common carotid artery, the right and the left common carotid artery. They are the chief arteries of the head and neck. Origin of the common carotid artery. The right common carotid artery arises in the neck from brachiocephalic trunk. The left common carotid artery arises in the thorax directly from arch of aorta. Now the branches of the common carotid artery are external carotid artery and internal carotid artery. Now we'll see the external carotid artery is one of the two terminal branches of the common carotid artery and supplies the structures external to the head and in front of the neck. The branches of the external carotid artery gives rise to 8 branches. They are as follows: superior thyroid artery, lingual artery, facial artery, occipital artery and posterior auricular artery, ascending pharyngeal artery, maxillary artery and superficial temporal artery. Now we'll see the branches of the internal carotid artery. The internal carotid artery is one of the two terminal branches of the common carotid artery. It supplies structures inside the skull and in the orbit. It is the principal artery to supply the brain and eye. The branches, they are follows: petrous part, pterygoid branch, cavernous part, it gives cavernous branch, superior and inferior hypoglossal artery. In cerebral part, ophthalmic artery, anterior choroidal artery, posterior communicating artery, anterior and middle cerebral artery. The knowledge of lymphatic drainage of the head and neck is extremely important because the cancer arising in this region have predictable pattern of spread through the chain of lymph nodes in the neck, which help the surgeon to remove the desired lymph nodes. The lymph nodes and the other lymphoid tissue in the head and neck are often inflamed and produce swellings, which are examined by physician in day-to-day practice. In this slide, the schematic diagram of lymphatic drainage of the head and neck, all the lymph from the region of head and neck drains into deep cervical lymph node. The efferent from deep cervical nodes from the jugular trunk, which on the right side drains into the right lymphatic duct and on the left side into the thoracic duct. The right lymphatic duct and the thoracic duct empty into the subclavian and internal jugular vein on respective side. Now we'll come to the applied. The subclavian steal syndrome. If there is any obstruction of the subclavian artery proximal to the origin of the vertebral artery, some amount of blood from opposite vertebral artery will pass in a retrograde fashion to the subclavian artery of the affected side through the vertebral artery of that side to provide the collateral circulation to the upper limb on the side of lesion. Thus, there occurs a sort of stealing of blood to brain by the subclavian artery of the affected side, hence the name subclavian steal syndrome is given. Now, what is Eagle syndrome? Normally, the tip of the styloid process is located between the external and internal carotid arteries just lateral to the tonsillar fossa. The elongated styloid process or calcification of styloid ligament can cause recurrent throat pain in the region of tonsillar fossa and upper neck, which radiates to the ipsilateral ear. It aggravates during swallowing. This clinical condition is termed as Eagle syndrome. Now, what is subclavian venous thrombosis? It can be spontaneous, primary or secondary. Clinically, it represents an edema of the upper limb, especially after exercise. Now, what is the primary thrombosis? Occasionally occurs due to excessive use of arm at the shoulder joint. The secondary thrombosis occurs as a complication of an indwelling venous catheter. The central venous line placement. The catheter is placed into a large vein, that is the internal jugular vein, subclavian vein or axillary vein, through which the fluid administration, the medicine administration and the hemodynamic measurements are taken. Thank you.